And now I will stop sharing my screen, and we'll go on to the next presentation. Thank you guys so much.
Good morning, everyone. Welcome to day 2 of the Maryland Sleep Society sessions. My name is Anita Nayak. I'm one of the pulmonary sleep physicians who serves on the board of the Maryland Sleep Society. It's my pleasure to introduce Dr. Jennifer Creamer, who serves as a major in the U.S. Army Medical Corps. Dr. Creamer started her career by receiving her medical degree at Southern Illinois University School of Medicine, went on to do her general surgery residency at William Beaumont Army Hospital in Texas, and then decided to do an internal medicine residency after that at Madigan Army Medical Center in Tacoma, Washington. She then went on to do her fellowship in sleep medicine and serves on numerous academic and has received numerous academic and military awards. She is the author of several peer-reviewed publications, and is involved in a performance improvement project which is focused on the improving readiness and looking at multi-specialty approach to optimizing the deployed sleep environment. She has written book chapters on trauma-associated sleep disorders as well. She currently is Assistant Professor of Medicine at the Uniformed Services University in Bethesda, Maryland, and she serves as Chief of the Department of Medicine at Martin Community Hospital. It's with great pleasure that I'd like to introduce her to begin her talk today on the role of sleep in human performance and in the military.
All right, thank you for that introduction. I'm very excited to be here today. I have since moved on back to Madigan Army Medical Center, so I'm joining you from the Pacific Northwest, watching the beautiful sunrise as we speak right now, but very, very excited to be here, so thank you. All right. I have no conflicts of interest or disclosures. And then standard disclaimer that these are just my views and don't reflect any views of the Department of the Army, the Department of Defense, or the U.S. government. So today we're briefly going to review the history of sleep in the military. We're going to define sleep deprivation as a barrier for performance in the military, and hopefully you can see this also as where sleep deprivation can be just a barrier to performance in general, especially in the medical field where we are encountered with sleep deprivation often, and also to better understand the physical and cognitive consequences of sleep deprivation with the military focus, and to discuss some mitigation strategies. So the overall culture of the military, unfortunately, we're still here. We are making some progress, but most people would agree that the culture still remains where if you're someone who can deprive themselves of sleep, still come to work, it's a sign of mental toughness and seen as an asset, and somebody who says that they need to sleep is still seen as weak at times. Hopefully, we'll continue to shift this culture where we can shift the military focus where sleep is something that should be valued. And that is my goal, to just keep pushing that message. And we are seeing some positive trends in leadership and what the Army is putting out in terms of sleep. So where did this start? It probably started even before World War II. But in World War II, we kind of had a shift to more nighttime operations, extended operations, and we really saw the soldiers who were fighting having extended periods of sleep deprivation. With all the young men being recruited into the military, it was a rite of passage, and it was almost also it had a strong association with their masculinity. And they saw after returning from combat that this sense of sleep deprivation and being able to function through things continued when they went back to their civilian workforce jobs. And also, it was praised, kind of like now, the soldier that could go longer without sleep was seen as somebody who was tough, and they would get accolades, leading to people even being prideful of their ability to go without sleep for long periods of time. Now, the other factor that did play into it in combat, and still does to this day, is not only is it something that is important during extended operations to be able to stay asleep, but there's a fear when you do fall asleep, you are leaving yourself vulnerable, and often it was reported where people were killed because they did fall asleep and they were no one was left for guard. Vigilance was down, and so that did create a significant fear to fall asleep. Another part was the enemy knew that if you didn't fall asleep, you weren't able to perform at your best. So there would be lots of artillery fire and noise overnight to prevent you from sleeping. And then the third part was the fear of if you fell asleep, there could be very dire consequences. And 1806, Congress actually made falling asleep on duty a capital offense. So not only were you leaving yourself vulnerable because you weren't awake to see the enemy, if you were caught, you could be punished to sentences all the way up to death. So there was fear of falling asleep for many reasons. So we are, like I said, we are seeing a shift from this culture of trying to be stronger by not falling asleep. In 2013, the Army launched its Performance Triad program, and this was a shift to calling us soldier athletes. So with a focus on proper sleep, proper activity, and proper nutrition. And I always, when I talk to the units about sleep and performance, especially now that we are referred to sometimes as soldier athletes, I find it, very interesting because professional athletes who are interested in how they can get a performance edge do take sleep very seriously and sleep for the recommended 7 to 9, if not even longer, when they are training for competition. This is just a slide I found with random athletes in different sports, and you can see the majority of them, are sleeping the recommended or higher amounts of sleep. Going further into athletics in terms of sleep, if you look at just the research done in sleep and performance in sports, going from like 2010 to currently, the research has really gone up exponentially. And you'll see a lot of it come out in the news. I know last year the NBA, it hit all the major news sources. There was an article on, or a interview on ESPN where they called it the dirty little secret that everybody knows about. And they talked about the extended sleep deprivation of the NBA players during the season, how it affected their performance, and also how it affected their testosterone levels, showing that their testosterone would continue to decline throughout the season as they had more sleep deprivation. We've also seen this recently in our Rangers when we look at them going through training with the extreme sleep deprivation that they go through, that their testosterone levels are lowered as well. And all the studies that look on if you extend your sleep times, if you align to the proper circadian rhythm, pretty much any sport that you look at, all levels of performance will improve with adequate sleep. And again, we've seen this in the military too, even shifting PT times to align more with your circadian rhythm. We've shown that morale improved, marksmanship improved. So across the board, we do know that sleep does play an extreme role in terms of athletic performance overall. As a military, even with this shift and kind of saying it's okay to sleep, we still do a very poor job as a society at whole. About 30% of civilians are sleep deprived, not sleeping the recommended amount of 7 to 9 hours a night. But as a military, regardless of the branch that you look at, about 2/3 of soldiers are reporting that they are getting less than the recommended amount of sleep. And the bottom line that is really, really hard to ingrain into anybody is that no matter how you train, what you train for, there is no training, motivation, willpower that can overcome the effects of sleep deprivation. And unfortunately, us as a society, we are just very, very poor at assessing how we perform when we are sleep deprived. Even in the medical field, I'm sure most of you can relate during training. Everyone says like, well, I've been doing this forever. I can function perfectly on 5 hours. It's all I need. But really when it comes down to it, if we were to test performance, we could see that you definitely weren't performing as you need to. And hopefully when we go through these studies, you can see how that, affects your life as well. So the consequences of not getting sleep, we all know on those days where we don't get a great night of sleep, if you're on call, sick kids, sick yourself, you're a little grumpy the next day. You might not be the best to work with. Your motivation for things goes down. Specifically in the military, the motivation to do PT, to continue to exercise goes down, and your motivation to stick to a healthy diet goes down. Your hormones actually take a shift when you get less than 6 hours of sleep overnight. Your ghrelin hormone goes up. I call it the gremlin hormone because it makes you eat more. And your leptin or satiety hormone goes down. Studies have shown that you eat around 300 to 800 more calories a day when you are sleep deprived and have increased weight gain, especially around the middle. Over time, it can be associated with chronic health disease. In the military, it can be associated with depression, PTSD. Overall, it can be associated with heart disease, stroke, diabetes, cancer, and even early death. So I always tell people, that saying, I'll sleep when I die, you are more predisposed to die if you are not sleeping enough throughout your life. And the thing to keep in mind too with the military is a lot of people, they are shooting for those 20-year careers. So I try to emphasize, 20 years is a long time. And if you do keep this up, you are going to see those consequences at the end of your career. So Banks and his group, they did a study that was published in JCSM in 2007, where they took a group of young, healthy, and late 20-year-old individuals, which are very similar to our military population. They divided them into 3 groups. One group that slept 4 hours, one 6 hours, and one 8 hours a night over a 2-week period. And they did performance testing. So this is the graphic looking at physical performance using the psychomotor vigilance test. And as you can see, the lapses in performance increased significantly over the group with over time and the group with 4 to 6 hours, which is, again, not surprising, but also, nice to see it laid out to show people how their performance declines over time. What they did find, though, is when they talked to the individuals and said, how do you think you're doing? Do you feel that this sleep deprivation is affecting your performance? They did not. They felt that they were performing similar to their baseline. So kind of goes back to the theme of insight into how you perform when you are sleep deprived is just very, very poor. And the same group in the study looked at cognitive performance as well using the digital symbol substitution test and had the same results. The group with 4 and 6 hours performed significantly worse compared to the group that got 8 hours of sleep over that 2-week period. In looking at sleep deprivation over 24 hours, most people have heard of, if you're asleep or awake for 24 hours, it's similar to you performing if you're intoxicated. So this study did look at, 2 groups of people, one who got the joy of staying up all night and the other who drank to the level of intoxication. And they did find that the group who was awake for 24 hours performed at the same level of somebody with a blood alcohol level of 0.1. So when I talk to soldiers, I use this and I tell them, think of it, if you're sleep deprived, you might not look like somebody who's intoxicated, but you are performing like that. And it's similar to the, intoxicated person that you've seen before. If you're out at the bar who thinks that, they're a really good dancer, they're a really good singer, where if you took a video of them and showed them the next day, their performance was not how they thought they were doing, to try to get people to understand, even though you think you're okay after that prolonged call shift or that prolonged staff duty, your performance is not as good as you think. And if you liken that to somebody who is intoxicated, who how their performance declines, it can give you a little bit more insight to how you're doing, and to also, look out for your colleagues who've been on call, and, look out for your battle buddies who have been on duty for an extended period of time. This article came out in 2019, where it looked at a group of individuals over really just a month time frame who had less than 7 hours of sleep over that time period. And what they found was that in the morning, when they did wake up, they had sleep inertia for up to 70 minutes. And then also significant sleep inertia within the first 2 minutes of awakening, worse in the biological night, which, most of us have experienced, if you're on call or you've been calling and attending, who may, the next day say, like, I have no idea, I can't remember that conversation that we had. And it shows that, over time, this can also affect your day-to-day with that, up to around an hour of sleep inertia in the morning when, most people are driving into work or starting their day, trying to make big decisions for the day, and you're not firing all that you should be, because you're still in that kind of sleep fuzziness stage. Yep. Sorry, I moved ahead too quickly. All right. In terms of athletic performance, which is fairly important to us in the military population, and even more so as the Army has changed its physical fitness test, making the new test the Army Combat Fitness Test, which does have a more significant weightlifting component. And one of the elements that is involved is the deadlift. This was just a small study looking at degradation in how you were able to lift at certain muscle groups over a 4-day period of partial sleep deprivation, and it did significantly decrease your performance over those 4 days. So this is, important overall if somebody is not able to, function on this new physical test. Everything that they're doing they think is right, just to look at that sleep portion, and that might be why they're unable to accomplish the levels needed to in order to pass the test. This comes from an Army infographic publication from the Army Public Health that was sent out to leaders last year. And this is a slide for sleep for leaders. They used a study of looking at soldiers in a special forces unit and how sleep deprivation led to increased musculoskeletal injuries. We all know that, when you're doing something, their injuries happen, but they did happen at a significant higher rate for those with less than 7 hours, and even higher for those with very short sleep deprivation, duration of less than 5 hours. Other studies have shown similar findings in non-soldier populations with lack of sleep leading to increased musculoskeletal injuries. Some of those factors that involved, when you do sleep less than 6 hours, we know your inflammatory markers go up. There's also been other studies in the military showing that sleep deprivation can lead to changes in your balance. And all these factors combined can lead to increased injuries. In terms of marksmanship, this study looked at 20 soldiers with a very short sleep period of just 2 hours per night. And although they found that their accuracy was consistent throughout the study period, the time to fire did go up, as well as the ability to distinguish between friend versus foe, which can be pretty serious. When they did ask them how they thought they did, again, They said, I think I did just fine, like normal, going back to that insight, that ability to see yourself, how you are performing. Now, for us in the military, our ultimate performance is when we go into combat. This is looking at around 500 deployed soldiers in terms of accidents and mistakes during the mission. And they found that over half of them were due to sleepiness, and they were, majority were sleeping less than the 7 hours of night during this mission. Again, not surprising, but always helpful to put it out into data for people to see. So we talked about, what happens, in the short term when you're sleep deprived, what happens, over a 24-hour period, what happens over a month period, but what happens if you don't sleep at all for prolonged periods. So a study looking at 275 service members with 112 hours of sleep deprivation showed that they had behaviors similar to that of schizophrenia, and when they were allowed to sleep, those behaviors dissipated. Now, there are studies showing with around 100 hours of sleep deprivation that some of these behaviors, psychosis, delusions that we're seeing can even last up to a couple months. In terms of animal models, we've seen in mice, rats, and fruit flies that complete sleep deprivation over time universally will lead to death. In those animal models, it was over a 10 to 30 day period where there was 100% mortality. All right, so we kind of talked about, like I said, the short term, the middle term, and the long term consequences. How does this affect the military overall in terms of their performance and well-being? Over the short term, you're going to see those lapses in judgment. The unit cohesion can go down. Just the ability to get along, to want to be there. Over time, your motivation to train goes down. You might develop a caffeine addiction or addiction to other substances. Your ability to accomplish the mission goes down. And then long term, we do see a lot of circadian scarring. Several of the veteran soldiers I see are the soldiers that are, have been in for more than 10, 15 years. They have that alarm clock that naturally goes off, at ODARC 30 on days off, weekends, and it's really hard to reset. And overall, it has led to an inability to retain and recruit soldiers as well. So we're going to take a shift now to looking at sleep disorders that are associated with combat, specifically nightmare disorder, trauma-associated sleep disorder, insomnia, short sleep deprivation, and OSA. So nightmare disorder is when you have disturbing, well-remembered dreams that interfere with your ability to fall asleep, stay asleep, or cause daytime impairment. These, to be clinically significant, they need to occur at least weekly. Trauma-related nightmares follow a traumatic experience. And there are, to date, very few studies that evaluate nightmare disorder in active duty military personnel. So in looking at degrees of trauma exposure, just to review a couple studies. So the first one was looking at dreams and nightmares after the Loma Prieta earthquake. So this was an earthquake in the San Francisco Bay Area in 1989 that killed 63 people and injured thousands, around 3,000 people. And what they found is that those individuals that were within the earthquake area had a twice likely event of nightmares compared to those that were just aware of the earthquake or in the area, but not directly in the earthquake zone. A study looking at school shootings showed that individuals who were in the school or just around the school had an increased rate of nightmares compared to those who were at home or geographically away. So this is important to note. Some people unfortunately don't go treated for their nightmares or might not feel comfortable sharing them because they weren't directly involved in a combat experience. But even if you weren't directly involved, your vicinity to a traumatic event can influence nightmares, and you can still have them even though you weren't directly involved in that experience. The largest study to date looking at nightmares was done in the Finnish population, where they looked at around 70,000 people over time. And what they found was that nightmares were higher in those in the war generation, and this was specifically World War II. And the prevalence was even higher depending on their exposure to combat versus if they were just home and alive during that war period. There was also an increased association with those in the war generation with insomnia, depression, and anxiety. In looking at the prevalence of nightmares and disturbing dreams in those with mental health conditions, the black bars are those who do not have a mental health condition, and the gray bars are those with a mental health condition. In soldiers who deployed to OIF and OEF, in the study, they looked at people who had around 2 deployments, and what they found was around 50% of those who had mental health diagnoses, specifically looking at depression and PTSD, had clinically significant frequency of nightmares of at least once a week, compared to around 10% of those who did not carry a mental health diagnosis. In my fellowship in San Antonio in 2016, we pulled 500 soldiers who referred to Wolford Hall for a sleep study. And what we found is, although around 4% were referred and put active nightmares on their reason for coming into the sleep clinic for evaluation, around 30% of them reported at least weekly nightmares. And of that 30%, around 60% were trauma related. We did also find an association with those with nightmare disorder, with anxiety, depression, PTSD, and TBI, and trauma-related nightmares seem to be the driving force behind this association. And there's also a strong relationship with nightmare disorder and insomnia. What was interesting, though, that they felt very comfortable reporting their nightmares, their frequency over questionnaires, but not listing it as a chief complaint. So I always use this in my clinic to give them the ability to, either report it, give them a questionnaire where they can report it, or ask them verbally to see how they feel comfortable. And most people do feel comfortable reporting on a questionnaire, and then we'll be able to discuss it further. But unless they are asked specifically, they won't feel free to share. And a lot of soldiers actually have told me that they just felt nightmares go along with being in the military. There's nothing to do, so why should I talk about it and why should I report it? Another thing that we've seen more frequently as we've gone back to combat is this constellation of findings of nightmares that may or may not have dream recall. As you remember, the definition of a nightmare is something that you actually remember, accompanied with disruptive nocturnal behaviors, which can be, in most cases that we're seeing, kind of like posturing, fighting events. Many soldiers have accidentally hit their bed partners, acting out a dream, and can also be associated with night sweats and racing heart. So when people do describe it, they often describe it very similar to this picture depicted in Netter. Or, I will show it to them and kind of say, is this what's going on? They're like, yes, that's what my spouse or my bed partner is describing. So with this, the sleep group at Madigan Army Medical Center in 2014 proposed trauma-associated sleep disorder as a parasomnia that encompassed all these things with the disruptive nocturnal behaviors, nightmares, as well as REM without atonia in trauma survivors. So below you can see the proposed diagnostic criteria, as well as an infographic of kind of the proposed mechanism, where you have that inciting traumatic event that could or cannot be combat related, because there's plenty of traumatic things that happen in people's lives. to include, car accidents. Also in the military, we see this after military sexual trauma. And that inciting event can lead to sleep deprivation, sleep disruption, a spectrum of trauma-related nightmares, leading to the trauma-associated sleep disorder. In the lab, we'll see REM without atonia. We can also see increased tachycardia, tachypnea, diaphoresis. Before, when we'd see these behaviors or they were described, it was generally described in patients with REM behavior disorder. But this, as opposed to REM behavior disorder, which is generally associated with the synucleinopathies, older patients, this is something that we're seeing in younger 20 to 30-year-old soldiers without any significant, neurologic disease. Another difference that we're seeing in this disorder is that they respond very well to prazosin, as opposed to those with REM behavior disorder that respond to benzos or melatonin. Since this proposal, there have been several further papers that have been published, and we're hopeful that one day that this actually can be a part of the International Classification of Sleep Disorders. Insomnia, probably the chief sleep disorder described within the military. We've seen a significant increase since 2003. You can see on that slide, it was a 73% increase from 1998. In the Army, they had the highest rate of increase, and their rate of increase from that time period was 120%. A lot of reasons, thoughts behind this. We've seen in Fort Hood, when they looked at questionnaires and surveys prior to deployment, there was about a 20% rate of insomnia compared to, civilian population that has around a 10% rate. In talking to soldiers, in general, they can relate their start to insomnia back to their first combat deployment. Another thing that was interesting that I've seen before, if you look at the rate of increase on this chart, if you pair that with the rate of increase of cell phone use, it actually is a very similar curve, which is some thoughts to, in the military, after, the invent of cell phones, you're never allowed to have kind of that fully free space. So you're always, worried that you're going to get called, you're going to have to come in. That inability to really relax and shut down can also perpetuate insomnia. Trauma-induced insomnia is a model that has also been proposed, similar to what we discussed in other disorders, where you have that traumatic event, which can activate your sympathetic nervous system, your HPA axis, leading to sleep deprivation. This has been shown to happen in the absence of PTSD, but can be a precursor to PTSD, depression, and also substance abuse. All right, and this is another study looking at soldiers who had deployed to OIF and OEF, where 40% of them showed that they had disturbed sleep. When they did look at those who had more significant insomnia, they found that that patient population also had the same symptoms qualifying them for PTSD, showing that, insomnia may not only predict PTSD, but can also be something where if you have a patient for insomnia, it should lead you in to investigate to see if PTSD is also present. Unfortunately, suicide is more prevalent than we would like in the military and the veteran population. Some of you may have seen like the 22 push-up campaign for the around 22 veteran soldiers who commit suicide a day. Even in our active duty population, I am currently serving as the surgeon over the Soldier Recovery Unit, which is the new name for the WTB. And since my arrival in November, we have had 2 suicides, unfortunately. And looking back through their records, both of them did have sleep complaints. So we do know that, when you have short sleep duration, it can lead to some disordered thinking, impulsivity, like we showed before. Your insight into your decision making isn't as it should be. We also know that insomnia can be a precursor to suicide. So if you do, have a patient that you're treating that you are concerned, there are other factors that may lead to some suicidal ideation. Treating both short sleep duration and insomnia could be potential places to start to help prevent a further suicide. So looking at sleep disturbances during deployment, not surprising, sleep is not prevalent, as we've talked about before, in the deployed environment. This study was in 2008 of 156 airmen, and it showed when they questioned them, most of their sleep variables were consistent with all of the diagnostic criteria for insomnia. The factors that they noted interfering with their sleep the most was noise, uncomfortable sleeping situation, and also concerns, just worrying about their family since they weren't able to be with them. And this is kind of some of the foundation that was provided to provide the basis of sleep disturbance during the deployed environment. And looking at just the effect of that short sleep time, sleep duration in OIF soldiers, what they found is those with short sleep duration and even the very short sleep duration, about 2/3 were reporting in that category. Again, going back to the majority of the military not sleeping adequately, and of those, 72% with this sleep duration, only 16% of them did say that their short sleep affected, or that they felt it affected their performance in combat. So again, just another data point of how, even though we know we aren't sleeping adequately, we're not really understanding how that affects our performance. How does the sleep duration affect mental health and high-risk behaviors? Those with very short sleep duration, again, that's less than 5 hours, they had the highest combat experience in this study, looking at around 1,600 individuals. And with that, they also had high comorbidities of PTSD, depression, panic disorder, as well as previous suicide attempts or suicidal ideation. Another factor that was associated with these with very short sleep duration is that they had the highest use of sleep medications, as well as clinical significant signs of sleep apnea. So goes kind of to show in there, that sometimes sleep apnea isn't picked up when somebody just comes in and says they aren't sleeping, where they're just given a sleep medication instead of kind of going in and digging into what else is going on, what else can be happening. Leading into sleep apnea. So just with insomnia, same time period, we've seen a significant increase in obstructive sleep apnea in military service members. That's, I always tell people, you do not have to be old, you do not have to be fat to have sleep apnea. Several of the soldiers that I've treated were unfortunately, not referred for several years because they were told that they didn't fit the right, the right patient demographic because they were fit. And there was no way that they would have sleep apnea, so they were given sleep medications instead. And often OSA and insomnia do occur together in the military, but unfortunately, one half of their sleep disorder was not treated for a long period of time, making it a little harder to treat when they do finally get their diagnosis. All right, so now that we kind of know how the lack of sleep can affect our performance. We know the sleep disorders that can be associated with combat in military personnel. What are we doing as a military overall to address all of these? So in 2015, the RAND Corporation, they did a big deep dive into sleep in the military, and what they found was that at that time there were several barriers. One of the big barriers that we've already discussed is that military culture. That culture that, sleep is not necessary, only the weak need it. There isn't a reason for it. And that, kind of boils down to that leadership knowledge, that service member knowledge of why do we need it? What is this actually helping me with? There's just kind of a lack of education throughout the entire organization, as well as not always the greatest access to care, to medical and further treatments for sleep disorders. And then lastly, the operational environment. The environment is usually noisy, not optimal for sleep, leading to those short sleep duration during combat, which can, further lead to other health disorders down the line that we discussed. So that was in 2015. So just this past month, there was a report to Congress about the effects of sleep deprivation and readiness on members of the armed forces. So this report was actually a requirement of the NDAA in 2020. And similar to the RAND report, they did find, that the education, the leadership knowledge is still very poor in terms of sleep and how it affects our performance. They did find overall that the acute and chronic sleep deprivation is overall detrimental to our readiness as a military, and can lead to chronic health conditions. And then they put out, similar strategies as the RAND Corporation of how to mitigate, and more guidance for leaders in order to help promote this culture change and this shift of sleep should be a part of readiness, as opposed to saying lack of sleep makes you an appropriate soldier. A guide for leaders out there currently is most recently updated in 2016, which does emphasize that sleep should be viewed as mission critical. Sleep deprivation does lead to mistakes, and then it also kind of outlined how do you go about assigning tasks based on the level of sleep. So top priority should always be given to leaders that have to make those critical mission decisions. Second priority is to those soldiers with sedentary activities, but need to have vigilance throughout them, such as those on guard duty or monitoring equipment. And third priority should be those that are doing physical labor, things that they're very active to keep them awake through it. And then finally, those who are resilient to sleep loss, which is kind of funny because we've been talking about, that lack of insight, but those that have been shown over time to be more able to function in a sleep-deprived environment. So one strategy that's been laid out both in the leader guide, also in the report to Congress, is sleep banking. So the problem with sleep banking is in order for it to be effective, it needs to be sleep on top of being adequately rested. So this is one study that looked at a group that got 10 hours of sleep for a night, then went into an extended operation of 3 hours a night, and compared them to a group that got adequate sleep a night of 7 hours, and how did they do in terms of performance. So you can see the group that got 10 hours, they still made mistakes. There was still performance lapses, but those were less than those who just got adequate sleep prior to that time of sleep restriction. And the other important part is they were able to recover back to baseline quicker. So it's interesting, I gave some fatigue mitigation and performance training to my unit the other day, and one of the transition coordinators came up to me last week And he said, you know, I talked to all my buddies, we're going to sleep bank because we're going to Vegas next week. And we want to make sure that we can get the optimal use of our time. So, you know, not only can you use this for, you know, performance in the field, I also encourage residents to use it if they're going from outpatient to an inpatient rotation, or, you know, vacation when you want to make the best of it. So can be a useful tool to put in your bag. Napping can also be great, different types of nap. There's the, you know, preventative nap that you can do prior to going into a kind of night shift or prolonged call, tactical or operational napping while you're on duty. And those are the shorter, kind of less than 10-minute naps. So in looking at the 10-minute nap, which seems impossible to do, but can be very effective, this is looking at groups of people that were stratified to no napping versus 10-minute versus 30-minute naps. And what they found is no napping or even 30-minute naps could lead to a degradation in performance, whereas those that took kind of that brief 10-minute nap were able to sustain their performance throughout the time period. This also can be enhanced by using caffeine right before the nap. I've heard some of my colleagues refer to that as a nappuccino. So that's something that can be used in the operational environment or even the call environment. Stimulants, they seem like a great idea for a society that has extended operations where you don't have sleep. You know, they're alerting, they can help performance. But on the flip side, you know, they can lead to, you know, impulsivity, addiction, overconfidence. So the Surgeon General at one point touted Benzedrine as the drug of choice. This was used in World War II by both us as well as the Japanese and British Army. You can see there's a nice little advertisement here for, you know, men in combat. When the going gets tough, you can use some Benzedrine. Stimulants were also used. The Japanese pilots used cocaine suppositories, and the Germans used a different type of stimulant as well. Fortunately, we did find that the side effects outweigh the benefits. We are no longer promoting stimulants for use in combat at this time. A lot of people, you know, to include our soldier population, use supplements, things that you can find in GNC. In general, these haven't been found to have any impact on performance with these substances. So caffeine is something that can be effective. It blocks our adenosine receptors. Over time, you can get used to caffeine. You can get some tolerance. But, you know, in the right setting, the right person, studies have shown that it could be just as effective as modafinil. And it's definitely used very frequently in the military. Andrew Jackson actually was the president who made caffeine and coffee a part of military rations. And so back in that time period, you know, caffeine, coffee became so associated with, you know, G.I. Joe that that's where the phrase, you know, a cup of Joe does come from. So that's a fun fact stemming from the 1800s. Current caffeine guidance for performance is 200 milligrams every 4 hours, cutting off 4 to 6 hours before bedtime. Always warn people not all caffeine is created equal. So, you know, do make sure the caffeine content that you are using. You know, unfortunately, I haven't had 200 milligrams yet of caffeine today, so hopefully I'm doing okay. But, you know, if you are going to use it performance, you know, do know how much you're using, and you can use it appropriately. So other things that we are looking at to optimize, there's a fun little acronym of SLANT, is the operational setting. So the surfaces that you're sleeping on, light pollution, air quality, noise, temperature. The Walter Reed Institute of Research is looking at all these factors and seeing what can we do to make the optimum operational sleep environment Recently, they deployed with the 75th Ranger Regiment, looking at, their flight over, what can they optimize so that way they're ready to go when they hit the ground. And then when they did get there, how did they create the optimal sleep environment from when they were there for them to perform optimally? All right, another alliance that we have made recently in 2016, Army Dental Sleep Medicine was created, and we've partnered with them for oral appliances, so not just for sleep apnea, but it is also approved for readiness limiting snoring. So it is great for our patients with sleep apnea. They no longer have to carry a bunch of equipment on deployment. And also, anyone who's snoring, who's keeping everybody up at night as well, can also use them. So that way the sleep environment is much quieter for everybody. So like I mentioned, the Walter Reed Institute of Research, they are doing a ton of stuff on sleep, looking at, where have we been, where do we need to go, and where do we need to go even further into the future to optimize sleep in the different environments, be it, garrison or in combat. So I do think we're finally going to see some changes. At this point, sleep environments are similar to what they've been for the past couple 100 years. They're not comfortable, they're not quiet, and they're not dark. So I do think a lot of exciting things are coming. So I do look forward to that and sharing them in the future. All right, so that's my spiel. Although this was kind of military focused, I do think there's a lot of points that can be translated into our lives as medical professionals and just humans in general. And then hopefully you got a couple pearls for seeing your veteran patients in clinic. Thank you again so much for inviting me. Really enjoyed talking about this topic, and I can take any questions at this time.
Thank you, Dr. Kramer. That was a really intriguing talk. And you can always judge the quality of a talk by the questions that get asked afterwards, and you have several of them. First of all, everyone complimented you on your excellent talk, and I would just start with a brief comment that, as you just mentioned, we can extrapolate a lot of what you've said to the civilian population, especially I think this year during the pandemic. Our healthcare workers have certainly been in a combat zone of sorts, and I especially see this in the ICU and our ER physicians, nursing staff. So I think a lot of what you've presented are things that we can talk about and probably will get data on going forward after this pandemic hopefully comes to an end. Let me start with one of the questions. Grace asks a question here regarding trauma-associated sleep disorder. Does dream enactment behavior occur only in REM or also in non-REM? And is there data about treatment, for example, PTSD targeted versus usual RBD treatment in this population?
So, unfortunately, as opposed to REM behavior disorder, a lot of these behaviors aren't caught in the sleep lab to say, are they specifically in REM or non-REM? We do think that it probably does occur in both, but still gathering data on that. There's a thought that, in this population, they actually tend to sleep better. And even I've had several patients report that when they come back, that that was a great night of sleep. I don't know what happened. What usually happens at home didn't happen. That could be part of kind of that battle buddy protective factor. They know they're being watched if anything's happening. All of the other external stimuli are gone. So that we don't catch the behaviors as frequently as you do with REM behavior disorder. To the second part of the treatments, if they're specifically been paired out to PTSD versus non-PTSD, to my knowledge, I know our group has not at this time, but most of the patients who do come in and get this diagnosis do carry a diagnosis of PTSD as well.
Okay. Thank you. There is also a question regarding your performance graph. One of our viewers noted a nosedive about 19 hours after wakefulness and wanted to know and inquire whether this was specific to any hormone regulation, you think, i.e. like cortisol. Do you think there's a relationship between that 19-hour mark and that nosedive in performance?
There could be, but I don't know of any specifics.
Okay. One more question was, does the Department of Defense have a joint military approach to approaching these complex sleep disorders, or is it more specific to each division? For example, he cites the Navy as having perhaps more 24/7 and circadian rhythm issues, or is there a unified approach to this within the Department of Defense?
So, right now we don't really have a unified approach. They did put out some DoD VA clinical guidelines on OSA and insomnia a couple years ago. But in terms of an overall approach, that is something that we are working towards, but there isn't one at this time. So, but the good news is, like I've shown, the oversight into sleep and how it does affect the military, we're getting more and more. So we're able to make these collaborations and actually start to make some longstanding changes, which is exciting.
Great. There's another question here. Does the military form OWL patrols and LARC patrols who would optimally perform at different times of the day?
Oh, that would be a great idea. And, we've put that out to leaders as well. You do know there's people that function better at night, function better at the morning. There is no universal strategy, so that is leader dependent if they identify that. But it's something that we've given advice on before, generally hasn't been completely followed through, but hopefully someday.
Interesting concept, yes.
Yeah.
Okay, I think we've covered most of the questions here, and I think, let me just double check. Again, thank you for a very compelling talk. We really enjoyed it, and I'm sure we can use a lot of this information and bring it out into the civilian world as well. With that, I think our next part of the agenda is our virtual exhibits, and I'll invite, I think, John Brown back.
Anita, thank you. Jennifer, that was wonderful. So please, everybody, Nappuccino, tell your friend, I want to see it in Urban Dictionary in about a year or two. Okay, and the other thing I will say, two things. One, I consider Jennifer to be what I would call the pride of the Army. You were looking at probably cream of the crop from military education in the medical military